José Maurício began experiencing vision loss, nausea, and severe headaches. After some tests, doctors found a brain tumor that needed surgery. During the procedure, he had a near-death experience and found himself in a different place, where peace surrounded the beings there. Hello, I'm Marcus, and it's a pleasure to have you here at Beyond the Life We Live. I hope you feel at home and absorb the lesson from the story we're about to share. By the way, leave a like and subscribe to the channel, as it's very important to us and helps bring more impactful stories to you. In 1994, José Maurício was working as a construction contractor, and about a month before the main event, he began noticing vision problems. He couldn't focus on objects, which appeared shaky. His life went on as usual despite that, and he was in a good place professionally, also enjoying his first daughter a lot, who was just 2 years old at the time. In April that year, after a normal day of work, he arrived home around 7 p.m., took a shower, had dinner, played with his daughter, and everyone went to sleep. The night, however, would bring a turning point in his life. Around 2:30 a.m., he woke up with an unbearable headache. Going to the kitchen to take a painkiller, he soon began experiencing intense nausea and continuous vomiting. The pain lasted the entire night until 6 a.m., by which time he was so disoriented from the pain that his wife took him to the emergency room. There, he was given medication and placed under observation. After about an hour, he finally began to feel some relief and ended up falling asleep. He woke up around 1 p.m. with the pain milder, but still present. Later that day, the neurologist came to speak with him. Without having done any detailed exams, just checking his blood pressure and asking a few questions, the doctor mentioned it was probably a migraine and was preparing for his discharge. That's when some medical students approached, asking for permission to examine him, and one of them performed a fundus exam that had not yet been done. What the student saw caught his attention so much that he asked a colleague to confirm the observation. Then, the student called the neurologist, who, after performing the same exam, congratulated the student. Immediately, the doctor changed course and ordered a CT scan. The results revealed a tumor in José's head near the pituitary gland, approximately the size of an olive. This tumor was compressing the optic nerves, which explained the vision problems he'd been experiencing. The neurologist explained that the tumor was likely benign, but would need to be surgically removed through a procedure called transsphenoidal, in which the tumor would be extracted through the face. The doctor who performed that type of surgery was at a conference in Germany, and only 2 doctors in the state performed the procedure. José remained hospitalized for about 20 days, undergoing pre-op exams and waiting for the specialist's return. During that time, his surgery was scheduled and canceled twice, as more severe cases were prioritized at that public hospital. Finally, one morning, he was surprised by the news that he would be operated on that day. Nothing had been scheduled, and he wasn't expecting it. In that moment, he felt a real fear of dying. On the way from the ward to the operating room, his life seemed to play like a movie in front of his eyes. He thought of his daughter, his family, his parents, what he had left behind, and what he had done and failed to do. In the operating room, there were about 12 to 13 people, including doctors, anesthesiologists, nurses, and students. The anesthesiologist was speaking with him, trying to calm him down. After receiving medication through the IV, the anesthesiologist asked him to count backward from 10. José believes he didn't even make it to 6. However, what seemed like just anesthesia was, in fact, the beginning of his first near-death experience. Instantly, he opened his eyes and found himself lying on a different surface, with the only physical sensation being pressure on his face. He also realized he had no sense of time in that place. He didn't know if he'd been there for minutes or hours. Looking to his right, he saw a female figure. She had a calming gaze, a sweet smile, and radiated peace and love. So, José asked who she was and where he was, and if he had already undergone surgery. She didn't speak with her lips, but he could understand her thoughts in his mind as she said,
"Don't worry, this will all be over soon."
Her hands were over his chest, as if transmitting some kind of energy. He felt an indescribable peace and tranquility. He stayed there for an undetermined amount of time, just looking at her, and she always kept that same smile. At a certain moment, she took her hands off his chest and began to move away. At that instant, José felt like he shifted states. The environment began to materialize around him. He saw walls. A nurse approached, and he immediately noticed that she wasn't dressed like the figure who had been with him. The nurse asked for his name and which floor he was on.
"Don't worry, you'll be taken back to the ward soon."
The night after the surgery was the worst of his life, as he couldn't breathe through his nose, only through his mouth, which caused dryness and bleeding. His stepfather, whom he considered a father, stayed with him the first night. After being discharged, he started having problems with vertigo, experiencing severe dizziness. Recovery was slow, with antibiotics and a lot of nasal discharge. He had to go to the hospital every 15 days in a process that lasted about 3 months. About a month and a half later, already feeling better, though his face was still swollen, he decided to visit his workplace against his wife's wishes. Feeling tired, he went up to one of the company rooms to rest a bit while waiting for the people he had arranged to meet. Lying on the bed facing the window, he was thinking about his work commitments. Until a few minutes later, he started hearing noises, voices of several people coming from another room. This scared him because he was sure he had locked the door and no one should be there. Trying to get up, he felt a tremendous force holding him down, as if he were glued to the bed. With great effort, he managed to get up and leaned on the wardrobe in front of him, stood up, and began to feel better. He stood there for about a minute when he felt a presence behind him. This presence seemed to place its hands on his back and spoke in his mind, telling him that he needed to go downstairs. When he left the room, he saw that the staircase had changed. It was no longer the staircase from the company. Upon arriving in a new environment, he noticed that there were several people. Some passed close to him, looked, smiled, and greeted him. The strangest part was that he noticed he could hear their thoughts, as if they were all speaking in his mind at the same time. He noticed that most of the people there were older, although a few were younger. When he got to the other side, he saw 2 elderly women. As they got closer, he recognized one of them. It was Dona Estela, a lady who lived in the house across from his workplace, a sweet and kind person with whom he had shared many years. Surprised, he asked,
"Dona Estela, you're here?"
She didn't respond verbally, just smiled at him, small and frail with her head lowered, looking upward and smiling. Asking if she was okay, the lady accompanying her replied,
Don't worry, she's doing very well.
Upon opening a door, he saw an intense white light that took over everything around him, and he quickly felt an indescribable peace and love, an extraordinary happiness. At that moment, he realized the presence accompanying him was no longer there, staying behind at the door. All he could see was the door. Everything else was white with a brilliant light that didn't hurt or blind his eyes. Something inside told him he needed to walk into that light, as if he had something to do there, and when he entered and walked into it, he remembered nothing else. He woke up around 1 p.m. in the company room, feeling very tired, but with a wonderful sensation. He remembers a strong desire to return to that place. Later, at home, every night he would lie down hoping to return to that place, so wonderful was the feeling. About 2 weeks later, he received the news that Dona Estela had been hospitalized with terminal stomach cancer. It was a shock to him, as she had been the last person he saw in that experience. Dona Estela remained hospitalized for less than a month and passed away. This made him reflect on why he had seen her in that experience. He believes they met by chance, that she was having the same experience at the same time, that she was finishing her journey while he was just beginning his. In his view, she was being prepared to make her transition. Time passed, and José Mauricio's life continued on its path, and to his joy, the tumor was benign and posed no risk of returning. After these experiences, his view on death changed completely. He no longer worries about death, but rather about his current life, morally and intellectually becoming a different person, eager to learn, discover, and understand who he is now. He also believes that everything he does in this life will reflect after death, so he tries to be a better person every day, despite having flaws like everyone else, realizing that time on earth is short, and for that reason, he tries to make the most of every moment to learn and bring good things that enrich his life.